we can go from there. And streaming live on YouTube. That's great. All right, I think we can go ahead and get started. So, hello and welcome everybody. My name is Milind Tambe. I'm the director of the Center for Research on Computation in Society, and it's exciting to welcome all to this seminar series again this spring. And today is the start of our first of the seminar series with our first speaker. And we will have these seminars every couple of weeks. Please, this is an exciting series, so I hope you will continue to join us. We will also have panels focused on AI for social good in general, and there may be other events as well. With that, I'm going to hand this over to Lily Xu, who along with Kai Wang, have helped us line up a very interesting series of speakers. So over to you, Lily.
Thanks so much, Milind. And I just want to thank you all for being here. I want to give Kai a second to just say hello too.
Hello, and happy to be here as well.
Yeah, and I'm just very excited to co-host this series with all of with Kai to all of you this semester. We hope that you keep tuning in, and we're really trying to keep have a large array of speakers across conservation, public health, security, fairness, humanitarian assistance, voting, all of that stuff. So there's a lot of good stuff coming in up through May. And if there are other folks who have really interesting work that you think is kind of at this interesting intersection of computational techniques focused on some sort of socially impactful project, we'd love to hear those ideas as well for, as this is a recurring thing every semester. But without further ado, I'm very excited to introduce today's speaker, Professor Hamsa Bastani. So Hamsa is an assistant professor of operations, information, and decisions at the Wharton School at the University of Pennsylvania. Her research focuses on developing novel machine learning algorithms for data-driven decision-making with applications to healthcare, social good, and revenue management. Her work has received several recognitions, including the Wagner Prize for Excellence in Practice, the Pierre Scala Award for the Best Paper in Healthcare, the Behavioral OM Best Paper Award, as well as first place in the George Nicholson and MSOM student paper competitions. And another exciting thing for all of us is that Hamsa is an alum of Harvard, having received her undergraduate here previously. So welcome back.
Thank you, Lily, for a very kind introduction. Thank you so much for having me. I'm a big fan of the work CRCS is doing, and especially a fan of Lily's work on conservation. So it's very exciting to be here. So I'd love to just do this as interactively as possible. So if you have any questions, please just chime in. But without further ado, I'll talk about some of the work that we've been doing in collaboration with the Greek government on using reinforcement learning for targeted COVID-19 testing. And before getting started, I should say that this is joint work with especially with a bunch of people, but especially Kimon Drakopoulos and Vishal Gupta from USC up top. John Lachagiannis was our software architect, and the rest of the Greek COVID-19 task force were basically public health experts and epidemiologists who greatly helped us with deploying the system on the ground. So before getting started, since this group is kind of largely focused on social good problems, I thought I would briefly mention my take on it. I think a big challenge that I'm sure has been sort of recognized by many other people when thinking about using AI in kind of in practice, a big issue is that often we end up with small data challenges, even though we have big data. So this might be for a number of reasons. So for example, you might have a new predictive task, like perhaps it's something that we hadn't collected data on before, before or labels before. You might have very imbalanced or rare outcomes, especially when you're thinking about adverse events or illegal events and things like that. Of course, there's always going to be a degree of non-stationarity that happens on the ground in practice, but when this degree of non-stationarity is quite high, then the trainings window that you have for your training data is pretty limited. And that means that you essentially have a small data problem because you frequently need to discard old data that you've collected. And finally, all of these issues are exacerbated by the presence of high dimensional features because then you kind of need your data sample to scale accordingly. So I think in machine learning, there have been two approaches to kind of help with prediction and downstream decisions when you have these small data challenges. One is Bandit. So that's this idea that you adaptively collect data in regions where your model is currently uncertain. And that way you converge faster to a better model and therefore better decisions. And another idea is to do transfer learning to leverage basically auxiliary data streams so that you can expand your effective sample size. And for some reason, these two literatures have sort of operated pretty independently with a few exceptions. But a big theme of the work that my co-authors and I have been doing is that they can actually work really well in tandem. So in Bandits, we think about balancing this exploration-exploitation trade-off. And the theory literature largely thinks about that asymptotically. But when you try to implement these algorithms on the ground and you have a bunch of these small data challenges, you often end up seeing that you have such high variance that your Bandit is just exploring and doesn't really get to exploit. And in these cases, transfer learning can actually be critical in order to reduce the variance of your estimators so that you can actually move on from exploration to exploitation. So we've kind of applied this idea to clinical trial design, doing personalized patient health prediction. And today we'll be talking about the Greek testing system, which I'll try to highlight has the same kind of challenge. So just to foreshadow things a little bit, this is a map of Greece. What we'll be talking about today is basically an implementation of a Bandit strategy that tries to allocate limited testing budget in order to maximize the number of positive COVID-19 cases caught at the border. But we'll see that this problem has a bunch of small data challenges, basically all the ones I outlined earlier. And so to actually get this Bandit strategy to work, we do transfer learning to kind of reduce the variance of our estimators so that we can actually make good decisions. Any questions before I jump into the context? Awesome. So when we got involved in this project, it was early 2020. So we have to rewind back a little bit in time. This was a time when we didn't have vaccines, rapid testing kits didn't have approvals yet. And so we were relying largely on PCR testing. We just learned about COVID. And Greece kind of went into lockdown like many other countries when they found out about COVID. And so they were starting off at a good point where they had very few cases, very few deaths, and so on. But that first summer, July 2020 was approaching, which is a first tourist season, if you will. And staying closed, keeping the borders closed and staying in lockdown during this time period was sort of economically untenable because tourism is actually 25% of Greece's GDP. Like many other countries, they were facing a challenge between their economic activity and their public health objectives. So they actually decided before we got involved in this project that on July 1st, 2020, they were going to open up their borders to non-essential travel so that they can get their economy up and running. But on the other hand, of course, they were worried about the public health consequences because now they're going to be letting in a lot of potentially infected but asymptomatic travelers who might then go and spread the infection amongst the general population, which might lead to dire public health consequences. So what do you do when you have this problem? Ideally, we would be able to test every single passenger at the border. If they test positive, we ask them to self-isolate so that they don't spread the infection. And if they test negative, we tell them, great, please go ahead and have your vacation and spend as much money as you can while you're here. The economy kind of needs it, right? But unfortunately, at this time, PCR testing was a very strained resource. And so it just wasn't possible to test every single passenger that would be coming to Greece. That scale was just way too large. And so what we proposed was the next best thing, which is to preferentially use that limited testing budget to test people who are most likely to test positive for COVID. And that way we catch them the largest expected number of infections at the border that we can. We can't catch all the infections without testing everyone, but hopefully by catching the most that we can given the testing budget, we slow the incoming rate of infections, which will then slow the spread at least until the summer ends. So that was the goal. And so we designed a tool called AVA. This is a real-time data-driven system that allocates limited testing resources largely to recommend who to test. We didn't come up with the name AVA. It had to be something that was friendly and single syllable and typically female, like Siri. And so that was the name they came up with. As a function of kind of the risk estimates that this tool is tracking, we are also able to help inform the Office of the Prime Minister on which countries to maybe graylist. So greylisting is this procedure where instead of opening up your borders unconditionally to travelers, we actually require negative PCR pre-tests for arrivals that are coming in from those locations. This is a bit of an economic and a political hammer. They don't like to do it because it has a lot of consequences. And so this is only something that would happen with human intervention if we're able to show evidence that basically the risk is starting to get very large. And then we also offer downstream interpretable insights for downstream decisions like mobile, where they should allocate mobile testing teams or ad hoc social distancing rules and things like that. So just to roughly overview how AVA looks, we have about 30 to 100,000 passengers who arrive every day, either by air, land, or water. These are pandemic numbers. So pre-pandemic, we got a lot more tourists. And then 24 hours prior to travel, they fill out something called a passenger locator form, where they report basically a set of features that we use to predict how likely they are to test positive for COVID. And then that all gets fed into AVA. And like I said, we have a pretty limited testing budget. So on average, we were able to only test 7,500 of these people. So most people will be told that they're not going to be tested, whereas some people will get a QR code. And so they will actually step behind one of these curtains. So this is an example from one of the airports. They get their swab taken, that gets linked with their QR code information, and that will get sent to a lab. And then we have contracts. Each point of entry has a contract with each with a fixed set of labs in order to make sure that those test results will actually come back into the system with at most a 2-day delay. And then that's used to update our predictive models, which is then used to make the next set of test allocation decisions. So the most important thing that's really helping AVA here is this dynamic feedback loop. So as we all know, the pandemic risk was highly non-stationary. So places were, spiking in risk and then coming back down. And so it was important that we were constantly collecting data at the border, using that to update our estimates so that we can stay agile and respond to shifts in the pandemic risk as they happened. Any questions at this point?
I have a question, if I can. Am I permitted to talk or do I write it?
Yeah, go ahead.
Okay, I would like to understand, could you explain more on why the labs should submit just the positive results and not positive and negative?
So, I mean, that's just an operational constraint because they don't want to fill out 7,500 entries. So anything that's not positive is assumed negative. There's a little bit, they also mark things that, were invalid tests. So let's say that you collect the sputum and then you see that it's contaminated. So they usually submit positives, undefined errors and so on, and everything else is assumed negative.
Okay, but AVA uses more information about the positive results, as I understand.
No, I mean, we assume everything is, by construction, everything that's not positive is negative. I should just say we get all the testing results. Maybe that'll be clearer.
Thank you.
Yeah, right.
I had a quick question, which you may defer till later, which is here you emphasized, not emphasize rapid tests. And I don't know if that would change things and how they could be added into the mix, but we can discuss that later if that's a better time to discuss.
No, that's a great question. So at this time, rapid testing, so again, this is early 2020, so it wasn't approved because there were a lot of concerns about accuracy. Now I think rapid testing is what they're using at the border, which is much nicer because A, it's more scalable and less strained, and B, it removes that 2-day delay, which actually has strong algorithmic consequences. So a lot of this is designed around the assumption that rapid testing wasn't available yet, but now that's obviously changed. Yeah, that's a great question.
Can I ask one question?
Yeah, of course.
Yeah, just curious. So when I look at this, when you build the model, you actually use the data that the people has been tested, right, to build your model.
Mm-hmm.
But you see, there's also people has no test, but we don't know if the people what is that positive or not positive. So this cohort was not involved in the model building, right?
Yeah, but because we are allocating tests somewhat randomly conditioned on these features, we can get valid counterfactuals for the people who are not tested. Right? I'll talk about that later.
Okay.
But there's no confounding here because everything is conditioned on the features that we observe and it's random otherwise. Great. So let me keep going. So this was a fairly large scale operation. It covered about 40 different points of entry that are coming into Greece. There are about 400 medical professionals and 300 border agents in the supply chain. And there were about 32 labs that were servicing the different points of entry. And all of this got pre-processed into a number of dashboards that we designed for policymakers. So this isn't a real dashboard, but it looks something like that, that basically carries risk estimates. And ultimately, we would have conversations every 2 days with the COVID-19 AVA Executive Committee. This is actually a picture of the Greek Prime Minister Kyriakos Mitsotakis with my co-author Kimon Drakopoulos, and he's pretty proud of that picture for obvious reasons. And so there was a constant conversation basically informing our models. So let me just jump into adding a little bit of notation here. So because the most important feature that we found for passenger risk was origin location, where they were coming from, which kind of makes sense. That is pretty informative of whether or not you're likely to test positive. And that's a categorical variable. So what we'll be doing is segmenting passengers into discrete types based on where they're coming from. And let's say that we have a type K passenger, and we say that their test outcome is a Bernoulli random variable with some expected value RK of t. So that's a probability that they're going to test positive. And importantly, that depends on both their type as well as the timestamp. So which period of the pandemic they're in, because again, it's very non-stationary. And importantly, this RK of t is not known in advance. So the main decision we're making is the number of passengers that we want to test of any given type at any entry on any day. So I'm going to call that N. So if we were to go and write down our objective, it's actually really simple. It's the number of people that we are testing times the probability that they will test positive, summed over all the entries, all the types, and all the days. So that's the expected number of infections we're going to catch. Our goal is to maximize this. So clearly, if we knew the risk, these RK of T's, then we're just going to follow a greedy strategy. We're going to find the people who are most likely to test positive, those risky passengers, and we're just going to allocate them our test budget until we deplete it, right? But of course, the kicker here is that we don't actually know RK of T. And importantly, our estimate, R hat K of T, depends on the test allocations we made in the previous time period. So let's say that we don't test any Spanish passengers because we think they're safe. Then later, if their risk goes up, then we are actually going to have a blind spot in our algorithm. We won't be able to recognize that they're risky. Right? And so the other thing that we have here is that we have a bunch of constraints on the test budget and then also the arrivals. So I'll first talk about the Bandit algorithm. So clearly here, there is an exploration-exploitation trade-off. On one hand, we want to basically do surveillance. So we want to test enough passengers from every type on any given day so that we know whether or not they're risky. We just want to keep tabs on whether or not they're spiking, because if they are, we want to make sure that we are testing them in the next time period. This also has a nice consequence that it's useful for the Greylisting decisions that the Office of the Prime Minister has to make, because in case a particular type starts getting really risky, then we can flag that country. But ultimately, our goal is to do exploitation. We want to use these estimates to aggressively test the riskiest types so that we can find and quarantine the most positive cases, slow the spread of the pandemic within the country, and ensure public safety, right? And so this trade-off has been well studied in the literature, in computer science, econ, OR, statistics, and so on. Popular solutions are upper confidence bound, Thompson sampling, Gittins index. We'll actually be building on something called the optimistic Gittins index, which tries to get the optimal dynamic programming solution, but then tries to, with a finite look-ahead window. So what a classical Bandit algorithm would do here, just to shed a light with a toy example, is let's say that we have only two types. We have Spanish travelers, ES, and we have German travelers, DE. And then we have our point estimates of the risk. It looks like Spanish travelers have a higher point estimate, but German travelers have a huge 95% confidence interval. So it's possible that German travelers are much riskier. We just don't know, right? So in this case, a classical Bandit algorithm, any one of those algorithms that I mentioned before, would likely start off exploring. So we would say, oh, well, German travelers might be very risky, so let's actually collect data on them. So that means we would allocate them a test. We would get the feedback, and then we would update our posterior. And now we see that the variance has actually gone down, and the point estimate has also shifted a bit. So now we're pretty sure Spanish travelers are riskier than German travelers. In which case we will move to exploitation. And so we will test Spanish travelers, we get feedback, we update our estimates, and we sort of proceed like this. This is what any Bandit algorithm would do in this setting, right? The algorithm we actually use, again, is called the optimistic Gittins index. It basically has an index that combines an exploitation term from the mean and the exploration term from the variance. I'm not going to go into details, but the optimistic Gittins index algorithm is very, very simple. You compute an index for each type, and then you just pull the arm that has the highest index. And then once you get the feedback, you update your posterior, and then you go back and recompute that, that index. And then you just proceed like this. So it's a very deterministic and simple algorithm. The way you compute the index is pretty opaque, but on the outside, it looks like a pretty greedy algorithm. Right. So there are a couple of challenges that show up here. So first of all, of course, our data is highly non-stationary. So to deal with this, we just spoke to the epidemiologists on our team, and they suggested discarding testing results that were over 2 weeks old, because you don't want to infer the risk of a particular location based on data that's very old, right? So that in itself is not challenging, but then combined with the next 2 points, we also have batch decision-making and delayed feedback. So batch decision-making means that we get the whole passenger manifest for that day, and we need to make all of the testing allocations upfront for that day at the start of the day. And this is because we're sending out these QR codes. If one of the points of entry loses internet connection, then we're going to have passengers who are basically pooling at an airport or something like that. And then they might infect each other, which is much worse than just making worse testing allocations. And so what we do is we make all of the allocations up front, and so there's no real-time delays that might be induced. But even if we could kind of make decisions in real time, we would still have the same issue because we have delayed feedback, right? So unlike that toy example I was showing you, it's not like we test a Spanish person and then we immediately get the result back like we would if we had a rapid testing kit. We have to actually wait 2 days for a truck to go pick up our samples, deliver it to the lab, and then the lab to enter those results and for us to get it back. And so that induces some challenges that I'll talk about in a bit. And then finally, we have constraints on the budget and the arrival mix at every point of entry. So just to illustrate, here's what would happen if we just take an off-the-shelf Bandit algorithm and apply it here. So let's say that we just have 4 types. I've gone ahead and computed the optimistic Gittins index for each one of them. The algorithm would say, okay, type 1 has the highest index, and so we allocate a test. But then unfortunately, nothing happens, right? Unlike that toy example I showed you, there is no update because I need to wait 1 day for this batch to end and 2 days for the sample to come back, right? So that means that the algorithm is going to continue to test type 1 passengers. And then once we run out of type 1 passenger, it'll test type 3 passengers and so on. So we're going to overexplore 1 or a handful of types while we're waiting for the testing results to come back, which is not great. And you might say, well, that's only a problem for 3 days. Asymptotically, this is not a big issue. But our data is only useful for a 14-day window because of the non-stationarity. So if we explore too much today, I'm going to discard all of that information 2 weeks from now. So an inefficiency of 3 days is actually a huge chunk of my effective time horizon. right? So this doesn't really work in practice. And this has sort of been studied in a literature called batched bandits. But unfortunately, these algorithms don't really work in non-stationary environments because they sort of follow an explore then commit type strategy. So you uniformly explore all your arms and then you commit to a good arm. And so the big challenge that we really have here is that we need to weave in exploration and exploitation within the same batch, right? So if I test a few Spanish people, I know that I have a bunch of Spanish tests that are en route, right? And so I want to make sure that I'm accounting for that information, for that variance reduction that I will get later on while I'm making my decisions right now. But of course, that variance reduction hasn't realized yet. And so what we do is a pretty simple trick that we call certainty equivalent updates. We just simulate that expected reduction in uncertainty. So when we allocate a test, I know my variance is going to go down. So I'm just going to go ahead and make that update right now anyway. So let's say that I have a beta distribution with alpha successes and beta failures. When I allocate a test, I actually update my parameters with one expected success and one expected failure. What does this do? This basically keeps the mean the same, but it reduces the variance of my estimator by one effective test. And so now when I actually have already allocated a certain number of tests to a particular type, I'll stop exploring that type because I know that my variance will go down in 2 days. So if we go back to this little toy example, we allocated tests to type 1, and then we actually see that type 1's index goes down because the variance has reduced after a certainty equivalent update. And so then we move on to type 3 passengers. And ultimately, what this does is it allocates the minimum number of tests that we need to allocate to resolve uncertainty for those high variance types. So that's exploration. And then all the remaining tests will get allocated to arms that have high mean, and that's exploitation, which is really the goal of kind of any bandit algorithm. Right? So the proof is in the pudding. So this is actually real data from our test allocations within a single day or a given batch. Because it's real data, I had to anonymize most things, sorry. So you'll see in the x-axis here are the different types. So these are country or city identifiers. So they're anonymized, but they're ranked from high risk to low risk, right? And on the y-axis, we basically see the number of arrivals. The pink portion of the arrivals are the people who are untested, and the teal portions are the people who are tested. So we see that within the high risk category, we're testing nearly 100% of all the arrivals. So that's exploitation. We want to go after these people to make sure that we're quarantining positive cases. But then you'll see that we're actually testing a non-zero fraction of kind of every type, and that's exploration. Any questions about this? Awesome.
Question about this issue with discarding data after 14 days. So is there a reason that you just do a plain discard instead of doing some sort of discount factor over time?
That's a great question. Yeah, so we talked to a bunch of the epidemiologists. We looked at the literature. So there's two kinds that you can do. You can do exponential smoothing, and that works like a discount factor. And that works well if you think that the underlying reward functions are changing in a smooth way, then you can actually show that that's statistically optimal. If you have sharp changes, like in a pandemic, you expect to see these exponential spikes, which are basically almost like change point detection type methods, then having a hard window seems better. In a typical bandit algorithm where you're looking at asymptotic settings, you'll usually actually use change point detection or something like that to detect these changes. But that involves a lot of parameters that you kind of need prior knowledge to fit. And when we started this project, nobody was, predicting COVID risk amongst tourist populations. And so we just went with the epidemiologist domain knowledge. In hindsight, we looked back to figure out what an optimal window size would have been to kind of minimize out of sample mean squared error, and it was about 10 days. So 14 days was actually remarkably close, which, I mean, that's not our contribution, but yeah, they knew what they were talking about.
There's
Awesome.
a question in the chat window. There's a,
yes.
go ahead.
So Kunal Relia asks, you don't have to go back, but in slide 15 and throughout this presentation, it sounds like the absolute value, the number of each type is considered. Why is the rate not normalized to account for a varying number of people, aka sample size in each type?
So the number of people that are tested. So the risk is normalized by the number of people that are tested. So the typical estimate of risk would be the number of people that tested positive over the number of people that we tested. Sorry, is that the question? I might have missed it.
Sorry for it's not clear probably. What I meant to ask was that in each type you allocate the number of tests that need to be done. Why is it not normalized based on for example, from each country, there will be different number of visitors that are coming in. And the positivity of each country would be different, and that would be independent of the number of people that come from that particular country. So isn't it important to normalize that as well?
Yeah, so maybe this will come up in a bit, but okay, so I think there's two questions there. So one is why we're not using the positivity rate of the country. So there's public data on that, and we don't, I'll show in a bit that actually is surprisingly not predictive of traveler risk who are coming to Greece. But the normalization of the population is something that's taken into account as a constraint. So we have arrival constraints on how many people are actually coming from a location. So you'll see here, in the high risk category, we test 100%. We can't really test more than that. So that'll show up in a bit.
Oh, okay, thank you so much. That clarifies. Thank you.
Of course.
I had a question as well. I really like this certainty equivalence idea that you mentioned on the previous slide. So that's great. There's different, is there any use to any demographic data that you may have? So some batches of people you may know from the passenger manifest, maybe there's more elderly people on a flight or more younger people on another flight, and the risks may be different. And is that something that could be taken into account?
That's a great question. So we actually collected gender and age information, and we put this in the predictive model, for the types, and we found it not to be predictive at all. But that's probably partially because of how this was operationally implemented. So like I mentioned, families fill out a passenger locator form. So any individual in the family might fill it out, but then they're putting down their age and their gender, and that might not be the person that we end up testing within that family group, because the family actually gets to choose who gets tested. And so the reason it might not be predictive was because the way in which we collected the data might not have preserved the integrity of that feature. Right? So it's not something that we anticipated ahead of time, but then at least on this data, when we look at it, we don't see that it's predictive. There are other features that we would have loved to collect that we didn't because of GDPR constraints. So things like occupation, like whether you're an essential worker, probably has high predictivity of your risk, but that's something that our lawyers didn't advise that we collect on the form. So there is some privacy performance trade-off here that we were concerned about. Great question.
Yeah, as well. So the high risk, low risk, the definition is based on the lab test outcome. Is that correct?
Based on the what outcome?
The lab test outcome, like the patient.
Based on the test outcome, yeah. So in a few slides, I'll talk about how we measured that.
Okay.
Yeah. So this is based on the data that we collected. We just look at the mean, we try to estimate that R hat KFT, the probability with which they'll test positive, and we're ranking based on that value. Okay, so since this came up, there are a couple issues here. There's a testing constraint. So every point of entry here, so this is a map of Greece. We're not that creative. So planes are airports, anchors are seaports, and cars are land ports. You'll see that they're all very heterogeneous in terms of the color. So red here means that they actually have very few tests per arrival, and blue means that they actually have lots of tests per arrival, relatively speaking. And you'll see that geographically, it's not like we can ship any point of entries test to any lab. So they kind of have a fixed budget, and that was determined prior to the start of the tourist season. And so some places have much less test availability per passenger than other locations. So that's something you want to take into account. And making things a bit more complicated, not every passenger types arrives at every point of entry. So here, like DE is Germany. So dark red here means a large value. So you can see that Germany arrives in huge quantities across all the different points of entry. So if you want to test a German, you might as well test them in one of these blue points of entry. On the other hand, MK is Northern Macedonia. So they arrive in pretty small numbers, and importantly, they only arrive to a few different points of entry. So they come to entry 40, entry 29, and so on. And that's because they're usually driving in. So they're coming in through these land points of entry. So that means that we better save testing budget at those specific points of entry. We don't want to have exhausted those budgets on, say, Germans when we could have tested them elsewhere, right? So this is just to say that the Bandit algorithm says, choose that arm that has the highest index and find a passenger to test. But there is a non-trivial decision here, which is that when you find a passenger to test, which point of entry do you want to pick them up from? Because wherever you pick them up from, you're going to kind of reduce testing capacity at that location. So you might want to save tests at certain points of entry for unique types like Northern Macedonians. This really feels like a problem that you should throw into a large scale, like linear program or something like that. We weren't sure how to actually interface that with the certainty equivalent update. So what we did was to just implement a simple greedy heuristic, where when we want to test a passenger from a certain type, we just choose, if they're arriving at multiple points of entry, we choose the point of entry that has the most remaining tests left. And that way we are least likely to, further constrain a port where we might want to save tests for unique types, right? So this is almost like a submodular kind of problem. So the algorithm itself is quite simple and it's extremely computationally efficient. I think it runs in about, so we have only about a minute to run this because we get the entire passenger manifest at midnight for the end of the day. And then the first flight touches down at around 12:05. And so AWS takes about 4 minutes to send out the emails with the QR codes to passengers. So we have about 1 minute to run this, but this actually takes less than that. So we get the passenger manifest, we get the port specific test constraints, we do these certainty equivalent updates for the last 2 days worth of data, and then we just get two simple tables. For every type, we have the pseudo Gittins index, and then we also have the passenger ID that's telling us which point of entry they're coming to and how much test budget is left. So let's say that we take the highest type. So the type 2 has the highest pseudo Gittins index. We identify all the type 2 passengers who haven't been tested yet. And so we see one that's coming to port 1 that has 500 tests left and another one coming to port 3 that only has 50 tests left. So then we're just going to greedily pick the passenger at port 1, we do a certainty equivalent update, and then we move on to type 1 passengers. And then we do this until we basically exhaust all our test budget or travelers. Any questions about how the algorithm works?
So quick clarification question here. So the passenger type, which is essentially country that they originated from, it's uniform. In other words, you're not separating out these people came from some other part of some particular part of Germany versus these people came from some other part of Germany. It's the whole country is one type. Is that right?
Great question. So I'm going to talk about that in 2 slides. So we do split up types based on city information adaptively. So we can't include all cities. So there's only about 170 countries that are producing travelers degrees. So that's easy to manage in terms of number of arms. If we threw in all the cities, it would be about 17,000 types. So that's too many arms. So what we do is we basically use lasso to pick out cities that are a sparse subset of cities that are especially risky, and we break those out adaptively into like multiple types. And that's much more manageable for that bias variance trade-off. I'll talk about that in like 1 slide.
Thank you.
Okay, so maybe let me jump into that. So the main thing I haven't talked about at all is how we are estimating prevalence or risk, right? And there's a bunch of small data challenges here, like I mentioned earlier. So first of all, the data is extremely imbalanced. So if you pick about 500 random passengers from this population, only one of them will test positive, which is fantastic from a public health perspective. If that number was much larger, it would be very irresponsible to open our borders. But on the other hand, that makes inference challenging because even though we're testing maybe 10,000 passengers a day, we're getting only a handful of positives to really estimate our risk. So the variance is huge. And second of all, the features are high dimensional because, as Milind mentioned, we don't want to just think about country information. We also want to think about more granular information like city. Like at this time in the pandemic, if you were from New York City, you were way riskier than like a standard US traveler. And so missing that out on that information is not great. So if we actually look at the histogram of our testing data, we see that 75% of countries had less than, maybe 200 tested passengers in the last 2 weeks, that window of data that we're talking about. So the variance is very large, right? So what do you do? I'll skip this, sorry. So what do you do when you have high variance and you're trying to run a Bandit algorithm? You use transfer learning, right? In order to reduce the variance of your estimates. So just to start this off, when you have imbalanced data, the problem is that predicting 0 is already very good, right? If I predicted that no one will test positive and only 1 in 500 are testing positive, I already have 99.8% accuracy trivially. So that's that 0 line that we've set up. That's how we've normalized this. And then we're looking at out of sample mean squared error. So if we use the vanilla estimator of just the number of positive people tested divided by the number of people that we tested, like akin to logistic regression, then we would be along the 0 axis here. And so the mean squared error of that is actually off the charts on this plot. It's much larger than just predicting 0 for everyone, right? So we actually really need to do some sort of joint regularization or some sort of transfer learning. So what we did here was we imposed an empirical Bayesian prior across all the different types. And so by that, we were able to regularize their estimates together. And so we get this red dot instead, which you can see actually has much better out of sample mean squared error than just predicting 0. And much importantly, way, way better than, just using the naive estimator. And the other issue that I mentioned is this type granularity. Do we choose the types at the country level? We choose a type at the city level. So what we did was we defined most of the types at the country level, because that was really what was critical for decision-making for the downstream policymakers. But then we try to isolate very risky cities by using Lasso to basically identify a sparse subset of cities that are risky even after conditioning on the country that they're from. So if we just look at this as a picture, if we had the US or some other country with 7 different types, we look at recent testing results and we see like most of them are around 2. Maybe this blue box is New York, that seems to have much higher risk. We throw in each location as a dummy variable into the regression, and we see which gets picked up in that sparse subset that Lasso picks up. And typically you'll see that only 1 or a handful get picked up, and those will get broken up into their own type, and everything else will be a different type. Any other questions about the algorithm itself? If not, I'll jump into the evaluation.
Yes, actually, I had a question. I posted it in the chat as well. So we do this port-specific trend analysis. So what is the likelihood of the presence of Simpson's paradox over here? Like the trends that we see when port-specific tests are done may differ when the numbers are aggregated. So does it make sense to at least assess for the absence of presence of the Simpson's paradox over here?
So I think that would only matter if different points of entry. So a big assumption here, which we think is true based on looking at the data, is that whether a German arrives at port of entry 1 or point of entry 2, they have kind of the same underlying risk, right? So this might be a little bit not true if you believe that people who are richer go to kind of the more privileged islands within Greece, and so their risk level might be different. But we don't, first of all, that was like a politically unsavory feature to use, so we weren't allowed to use it. But looking at the data, we don't see any evidence that conditioned on the type that there's any information on which point of entry that they are arriving at.
Oh, okay. So basically the trends kind of stay consistent at both specific levels and at the aggregated levels, you mean?
Sorry, I didn't catch that.
So the trends are kind of consistent when you do port-specific studies and when you kind of aggregate the numbers at the national level.
Yeah.
Oh, okay.
Nation being the type, not Greece.
Yes, yes. Thank you so much.
Yeah. Other questions? Great. So a big question that, of course, everybody had was whether this actually worked. It was a big financial investment for Greece. So we did an evaluation of whether it worked or not. So the nice thing about running a Bandit is that we have enough exploration. And so we can usually use that to compute valid counterfactuals of other policies. So we know how well our policy worked. And our goal is to figure out how, say, a different policy would have worked. So when we first got involved in this project, Greece was considering doing random testing. So this has no no infrastructure cost at all. You just pull random people off the customs line, kind of like TSA pre-check or something, not pre-check, sorry, TSA exams. And so it has no infrastructure investment, but then, it might be less efficient, right? So we actually use something called inverse propensity weighting. It's kind of an off-the-shelf method. And we actually see that the inverse propensity weights are really well behaved because we have this non-stationary bandit. So there's a lot of randomness in the algorithm. And so this red line here is how well our tool AVA performed in terms of the number of positive cases that we caught. This teal line here is the estimate of a random testing policy. So importantly, inverse propensity weighting doesn't make any assumptions like we've made on how well we are able to predict risk. So it might be that our model is very poorly calibrated or something like that. It still gives you an unbiased estimate. It's model agnostic. And so what we see is we get about an 85% improvement in the number of positive cases that we caught given the same testing budget. Right. So just to put this in context, we used about 7,500 tests a day at the border. If we wanted to get the same number of cases caught with random testing policy, we would have needed 14,000 tests at the border, which incidentally was the entire testing budget of the country. So they wouldn't have been able to do any internal testing or contact tracing and so on. So this was a big supply chain improvement. You will see that in the off-peak season, the gap between the two actually narrows and it becomes only 36%. So this is because it looks like this targeting or bandit type of approach is really only useful when your resources are scarce. So we always have about 7,500 tests per day, but in the peak season, we have a lot more arrivals, whereas in the off-peak season, we have a lot fewer arrivals. And we see that our improvement compared to random testing is actually much larger when the percentage of people that we are testing is much lower. So in the off-peak season, we're testing a lot more people. In the limit where you test 100% of arrivals, all policies would be exactly the same, right? But then you might say, all right, well, random testing is kind of a silly comparison. Maybe we should compare it to targeting based on some of these epidemiological metrics that are being reported by all these countries, like on Ovid and things, or Johns Hopkins or something like that. So every country at this time was reporting cases per capita from their general population, deaths per capita, positivity rates, and so on. So this would still require that same financial investment that Greece made for AVA, except that the algorithm they would be using is, instead of using reinforcement learning, they would instead just be using these public metrics. And here we see about a 25 to 45% improvement in the number of cases caught. So this is almost like a free improvement that we get just by using a more intelligent algorithm. So this kind of highlights the value of kind of these state-of-the-art machine learning approaches. For a number of reasons, it's actually, yeah, go ahead.
Oh, sorry. Just to clarify on this comparison, you're saying like, if you just kind of greedily optimize, like, oh, maybe German residents have the highest like death rate metric right now, and so we'll just test all the Germans. That's like what the comparison is. Yeah.
So it would exactly, but we would still allocate based on the testing budget. So it depends on how many Germans we're actually getting. If we run out of German arrivals, then we move on to the next location that has the highest deaths per capita. Yeah.
Well, thank you.
Of course. So for a number of reasons, it's actually an underestimate, because what happens in a bandit is that you actually invest a lot of resources doing exploration, right? So that we can get good estimates of every arm. And then we, go after the highest reward arm. But in this context, whenever we find a really high reward arm, it actually gets taken out, right? Because the office of the prime minister will then graylist that location. We stop getting really high risk arrivals from that location, which is of course the right thing to do from a public health perspective, but it kind of, we might not even have realized that that type was high risk if we hadn't invested in exploration, right? So if we actually try to correct for this, then our estimates, so we actually graylisted about 10 countries based on AVA's estimates. It's a little bit tricky to compute counterfactuals for this. It's not as clean as the inverse propensity weighting method, because it reduces both the prevalence and the arrivals. But if we try to do this, we get a rough estimate of, instead of an 85% improvement, we roughly double the number of cases caught. Okay, so before jumping ahead, I wanted to talk a little bit about why we didn't use the public data estimate. So a big question that we usually get is, every country is reporting cases per capita. The EU was actually using that as its metric to decide which countries were safe and which countries weren't safe. And so why we didn't use that, right? And this plot, I think it makes it very stark. So on the x-axis here is the new cases per million from public data, the y-axis, and the x-axis here has the prevalence as measured by our lab data that we are collecting at the border. And this really you would expect to be a straight line or have a very strong positive correlation, because if we think if they have a high cases per capita metric, we expect them to have higher risk here and vice versa. But if you look at this plot, you'd be hard pressed to say that it has any positive correlation at all. And there are a number of reasons we think this might be it. So first of all, testing was very scarce at this time. That's why we even have this problem. And so every country had some sort of censoring that was happening, right? So like in the US, we were targeting tests towards high risk and symptomatic patients. And so we weren't necessarily testing the general population randomly at this time. And more importantly, that population is not representative of the tourist population, right? So we're testing high-risk symptomatic patients, but the patients that are the people who are actually coming to Greece on vacation, you know, in summer of 2020 are kind of your low risk, asymptomatic, like younger population. And so those are just different populations. Another reason a country might have low cases per capita is because they are just not reporting their cases, or they're not testing enough people to know that they've caught these cases. And then finally, there are just infrastructure delays, right? You're trying to compare people locations across the globe, and different locations obviously have different infrastructure. And so we actually found that for one particular country that I can't disclose, so this green line here was the risk that we were measuring using our data. And this red line is the public data. So we actually found that they were spiking about 2 weeks before they actually spiked on public data, right? And that would obviously be a very costly thing for Greece, because we would be letting in all these passengers until we actually saw them spike in public data, right? All this to say that in-house testing is actually pretty critical in these contexts, because that's how we collect actual ground truth data for the population that we are interested in. Any questions? Lily, am I at time or?
We have 8 minutes remaining.
Fantastic. Okay, so maybe I was really excited again to visit this group, because I'm a big fan of all the social good work. So I wanted to briefly mention maybe a few other applications of this kind of bandit / transfer learning concoction, if you will, for other social good applications. So one thing that my group has been working on is transfer learning for clinical trial design. So this is joint work with my PhD student, Ariel Anderer, and John Silberholz, who's at University of Michigan. So in any kind of cancer clinical trial, we typically have a long-term true outcome that we care about, like overall survival. So we want to approve drugs that improve overall survival. But these typically take a long time to measure accurately, because luckily patients are likely to live for at least a median of 2 years, say in metastatic breast cancer. But at the same time, we have access to short-term outcomes, so things like progression-free survival, which you tend to observe much sooner than overall survival. So on one hand, this can actually greatly speed up clinical trials by looking at the surrogate outcome instead, because now we can get information of which drug is better on that outcome much sooner. But of course, the issue is that we don't know if a drug that improves the surrogate outcome actually improves the downstream true outcome. So one thing that we've been doing is trying to design clinical trials that leverage both types of outcomes, right? So at any given point in a clinical trial, we've typically observed many surrogate outcomes, and we've observed a few long-term true outcomes. And so what we do is we use a large database of prior clinical trials on the same drug, and we use that to learn a relationship between the true outcome and the surrogate outcome that we can leverage online in the current clinical trial to make better drug approval decisions while maintaining a type 1, type 2 constraint. And so we see that that can actually give us shorter trials, lower patient enrollments, and just better outcomes for the patients within the trial. Another problem we've looked at is kind of identifying sex trafficking recruitment. So this is work by my student Pia Ramchandani with Emily Wyatt from the Tellfinder Alliance for Global Counter-Human Trafficking. So this is an organization that largely uses deep web data to try to figure out where sex trafficking is predominant to kind of help law enforcement conduct stings. And for our particular relationship, they were interested in understanding how recruitment happens. So how victims are actually pulled into these supply chains, possibly by deceptive offers. So you actually ask a victim you offer them a job in massage or modeling or other personal ads. And then once they respond to the ad, they actually get trafficked into the supply chain. And so this is a big classification task that's essentially happening with very few labels, and it suffers a lot of these small data challenges because it's like picking a needle out of a haystack. And so this is another setting where we basically use active learning, which is very similar to Bandits, but it's kind of critical to use transfer learning to learn across locations and learn across different types of violations. And finally, some stuff we've been doing on content moderation with Facebook. I guess now they're called meta platforms. So they're obviously interested in removing policy violating content, right? So there's a lot of content where there's violence or graphic content, hate speech, bullying, and so on. And they want to make sure that this gets removed in a timely manner. A lot of content can't be automatically deleted. It needs to go to a human reviewer to be manually removed, depending on whether or not it's policy violating. So this is actually very similar to kind of the Greece problem. Like we have a very limited budget of human reviewers, so they act like tests. And our goal is to prioritize the content that is most likely to be violating in order to maximize the amount of harmful content that we are able to take down, given a fixed budget of human reviewers. And so it's impossible to manually review all the content given the scale of the problem. And so you can actually formulate this as a very similar kind of bandit problem, where you have a non-stationary or adversarial environment because people are constantly changing the trends in which they're able to violate. And we try to do some transfer learning across the different risk types so that, again, we can control the variance within a limited horizon in practice. Right? And that's it for me. Thank you guys for having me again.
Thank you so much.
Yeah, go ahead, Libby.
Thank you so much for a wonderful, very, very engaging talk. There were so many interesting points that came up throughout. It was really great to hear about all the nuanced decision making that came in having this actually be a deployed system in Greece. So very inspiring.
Thank you.
Thank you. Thank you for an excellent presentation. So much to discuss. Hopefully we'll have you visit in person sometime, but perhaps there's other ways to have discussion. Thank you.
Fantastic. Yeah. Thank you.
So we are near the top of the hour. So if anyone needs to drop off, please feel free. But Hamsa, if you're able to stay on, no pressure at all if you need to leave, but I'm sure that more folks have questions. And I do have one, but I'll let others go first.
I can stay for a few minutes, yeah.
I invite people to just directly unmute Jesse, maybe.
Yeah. First of all, thank you so much for the talk. Really enjoyed it. I guess I'm curious if you guys thought about any way that you could maybe try to like almost discretize these risk estimates to try and make it more efficient, or like if you think that would work generally. So maybe instead of trying to say, oh, this person is 5% likely, like, or I guess 6% likely, maybe 5 to 10%, something like this.
Right. So I think the risk estimate was also, the average risk was also evolving during the course of the summer because most places were actually on lockdown at the beginning of the summer. So I think it was actually quite rare to even get, almost all countries were like 1 in 1,000 when we started. But then by the time the summer kind of progressed, a lot of locations had kind of opened up their borders or had, less restricted travel policies and things like that. And so we saw that the average risk itself was kind of increasing over time. So I do believe that you could do like some sort of a low risk, high risk type of binarization, if you will, but that would have to be adaptive over time as well, right? So we didn't do it because it wasn't clear how we would design that. But I think in hindsight, possibly yes. Question.
Hi.
Kai?
Thank you for the great talk. I had one question regarding the unstationarity of your result. So I guess for arbitrary unstationarity, I guess you could destroy your result and also the guarantee. So do you assume do you have any assumption on the stationarity, or like could you elaborate more on that?
So I don't think there is any theoretical guarantee here, because in non-stationary bandits, you only kind of get any kind of technical guarantee on the regret if the non-stationarity is small compared to the length of the horizon, right? So usually you assume there's some variation budget and it's, sublinear in T, or you assume there are only a finite number of, like there's an O of 1 number of points of changes, right? None of which is true in practice, right? Because here we were basically seeing like continuous changes and continuous spikes, and there's I don't think there is like kind of a nice budget that we can put on that. So I don't know, but I think that the assumption here is that, the last 2 weeks of data is relatively reliable, right? So I think that was reasonable in this. I mean, it's never going to be exactly right, but when we looked kind of in hindsight, 10 days was kind of the right cutoff to make sure that we were minimizing like out of sample mean squared error. The nice thing that happens here is that I think there's a bias towards over testing rather than under testing, right? Because if a location spikes, then most of that window of data is going to be dominated by the spike. So it's more likely that you will think that they're higher risk. Whereas if a location, so if you have too long a window, you might be even after that spike dies down, you're going to keep testing them, which is safer, I would say, than the other way around, where you actually stop testing them because you kind of cut off that window. That's just my rough intuition. We don't have any theoretical analysis along these lines.